Everyone, thanks for joining us today. I'm Natalie from the Education Liaison team, and I'm joined by Caroline Sargison, who is our senior admissions tutor here at the University for Nursing and Midwifery, and we're here today to talk to you about how you can support your students and prepare them for nursing or midwifery interviews. And I'm going to hand over to Caroline.
Hi, hello, welcome everybody. Thank you for coming to see us today. Just to give you a bit of background on me, I am a nurse, but I'm also an academic, but my main responsibility is managing the recruitment and selection processes for nursing and midwifery. And as I'm sure you're aware, these programs remain popular year on year. So I just want to give you a bit of information perhaps to help your students prepare. And obviously, if there's any questions you've got, we're more than happy to answer those. We are already open on UCAS for applications and receiving them, but we won't be starting any actual interviews until after Christmas. So we want to look a little bit about, how you can help your students prepare before they apply, how they need to, and you're very familiar with the application processes anyway. And then the main thing that we use as part of our application is their interview with us. And that, again, will remain online this year, but I'm going to give you some possibly hints and tips about the interviews, because I did most of the interviews last year because my colleagues were so busy with COVID. And then obviously we've got some dates, and then there's any questions that you've got. You can put questions in the chat as we go along if you like, and we'll pick those up at the end. So last year, just to give you a bit of an overview for our programs, and we have around 494 places, but that does include our postgraduate diploma in midwifery and mental health. And applications on a whole were up last year. The biggest ones usually are midwifery, but actually strangely last year, the biggest increase in applications was for mental health nursing, and that was up 30% last year. So the most popular programs, I would say, are normally our child and midwifery programs. So for our midwifery, we had an increase of 15% in our applications. And we made 30% more offers than we had done in previous years. Now, the reason that's important is that there will be this year a glut, I would suggest, of people who didn't get in last year. So they will be competing with the people who are applying this year. So one of the reasons the major reason I would say during interviews why applicants aren't successful, and we try to make our interviews as relaxed as possible, and we try to make them more of a conversation than a question and answer thing. It's to try to get the most out of our students, to help them be relaxed. We send them quite a lot of information to help them prepare about the areas we're going to be looking at. The area that worried me the most last year during interviews was people who were applying for child nursing, because it was fairly clear that most of them didn't really explore what it would be like to nurse sick children and teenagers. There was quite a lot of them that had a focus on well children and interacting with well children. Very little focus on families, very little focus on some of the social issues around nursing. Lots of things about putting smiles on faces, which is not really what your role is as a nurse, but they didn't really grasp the complexity of nursing a sick child. So for the weaker applicants, for want of a better phrase, I would suggest that they haven't really looked into what it means to be a nurse and what nursing actually means. There's lots of talk about being caring and kind and compassionate, which is lovely, but not a lot of focus on the actual role of a nurse, what nurses do. I've just realised we've got a spelling mistake in that slide, Natalie.
I know, I see it. Sorry.
Okay, it's not very good for university, apologies for that. Okay, next slide then. So this is much more Natalie's area than mine, but as I'm sure you're all aware, UCAS applications are particularly important in terms of there being their their way in. And I do all the shortlisting for the university. So I shortlist all the nursing midwifery applications. And the reason people don't get past shortlisting, and as a rule, we have a very wide gate, is missing qualifications. So if they haven't got all their qualifications on there and they're pending qualifications, that usually means they won't progress. So that means that they need to know that they've met our entry qualifications by checking them against the website. Quite a lot of them often fail to include their level 2 maths and English. And the other issue that we have with level 2 maths and English is if people are awaiting GCSE results in August, then we can't accept them. And this is because we need to have our numbers firmed up before clearing. So anyone who's got pending maths and English for the August the 25th date, that will lead to them being rejected at shortlisting. We can accept them with pending functional skills because they will get those results earlier. Natalie, is there anything you want to say about the UCAS application?
Really just to ensure that your students are completing the whole application, really. Like Caroline just said, around qualifications, it's important that they add all of their previous qualifications because they are relevant. And they have the certificates for them as well, because they will be asked to upload them or to show them at interview, depending on what university they are looking at.
So the GCSE decision that we have, other universities are happy to accept students with pending GCSEs, but it's always worth checking on the websites because that's often where students get rejected.
Yeah. And then obviously their personal statement which is what they're all working on right now. And then that's what Caroline will make her first decision on.
Yeah, and please be assured we do read their personal statements. So please tell your students they are very important and we will read them. So for Middlesex, we have 2 different tariffs, one for midwifery and one for nursing. For nursing, this is adult mental health and child. We ask for 112 tariff points. So that's a BBC or distinction merit. Access, we ask for merit or higher in their units. And also, as we've said, we will consider functional skills or equivalencies from international qualifications for that. For A levels, for midwifery, we ask for a slightly higher tariff at 120. So that's distinction merit. And the access course, we need 15 credits at distinction and 30 at merit. So
yeah.
No. One of the questions that students often ask at interview is where our placements are. And we sort of sit across the top of North London. So we go from the Royal Free to the Whittington and then North Mid, Chase Farm. For some of the midwifery placements, we do have Queen's at Romford, and we also have Whipps Cross. We have some placements there, but that's only for midwifery. We also have private hospitals, care homes, and the community trust within those as well. But we allocate the students to their placement areas. We try to keep them within the same trust, and we try and allocate via postcode. However, one of the other issues that might be worth raising with you today, which has obviously come out from the NHS, is about vaccinations, because we won't be able to place students who are unvaccinated. So at the moment, we can't place students in care homes who are unvaccinated. And now it will seem that our trust won't be able to accept them either, because of the potential ruling that all students have to be, all care workers and nurses will have to be double vaccinated. So this might be an issue that's worth raising with your students at this stage, because if that's an NHS ruling, then no university will be able to accept them because we won't be able to place them. So, we can offer alternative programs, but I know that the dean and the senior members of the nursing team are meeting with our students, because obviously we already have students on the programme who've made decisions about their vaccination status. But for new students coming in, if we can't get them placed, then they can't complete their practice hours, which means they won't be able to register them as a nurse. And it would seem like they wouldn't be able to gain employment as a nurse either, or midwife. So there might be some discussions worth having there. We thought this was coming, but it seems to be now once the care home said that they were doing it, it looks like the hospitals would follow suit. Okay, next slide, please. So the interviews are really important to us. We enjoy meeting students, and sometimes they are, you know, we know students are nervous, but we do try our best to put them at ease and to get the most out of them. We did have a few incidents last year of students turning up in their pajamas and dressing gowns, which didn't create the best of impressions. And when I challenged one applicant about wearing her dressing gown, she told me it was Saturday morning, and obviously felt that it was enough that she was there. So we are aware that for some students it's difficult to find safe spaces or quiet spaces to interview, and you know, we'll happily have a discussion around that. We're well aware of issues around IT and those types of problems. We have to stay online at the moment. We would like to bring our students into interview because I think it's important for them to come into the university, but for safety's sake, at the moment we're staying online. My first advice would be for students to read all the information that they're sent. Natalie and her team have come up with a fantastic booklet which basically covers all aspects of interviews and about how to prepare for it, and it's not just for us, it will help them, you know, wherever they're applying. I know some universities still do their multiple mini interviews and different formats. Ours is a really simple sit down, we will ask you some questions. There's, as we say to them, there's no tricks and we're not trying to catch them out, we just want to have a conversation with them. So it's about, you know, their motivation and their understanding and their insights. It's as simple as that, and obviously anything that they would like to ask us. One student last year asked me if we had a library, which I thought was a slightly bizarre question, as it wouldn't be much of a university without one. Lots of questions around placements and ideally their decision about, I mean, you know, we are aware that students are choosing us as much as we're choosing them, about their decision should mainly be focused on getting to their placements, because obviously that's where they're going to be doing their early starts and late nights. We normally have at least 2 people on the panel. Last year, as you can imagine, it's been very difficult to get clinicians to attend interviews because they're stretched to the max. So it's usually either 2 members of the academic staff, or we have service users from the community as well who come along. And it is just a question and answer. But, you know, the best advice you can give to students is, you know, what would they like us to know about them? Have they got examples they'd like to share with us? It doesn't have to be all about clinical work. People get very worried because they don't have healthcare experience or working with vulnerable people. And, you know, we're really aware nowadays how difficult it is with COVID. But lots of students overlook, first of all, the importance of their academic work. And again, this comes back to personal statements as well. People are very focused on clinical and caring, but the academic work is 50% of the programme. And obviously, sometimes that's the most challenging bit. So, you know, how do they manage academic work? What have they learned, particularly perhaps for mature students who've come back into studying? What kind of things have they discovered? But anyone who's worked in any setting or been part of teams or groups, all those skills, you know, team management, communication skills, self-management skills, anything that's been with dealing with the public, anyone who's worked in forward-facing jobs. I shortlisted somebody the other day who'd been a complaints manager for Butlins, and I thought, well, that must just be so challenging. But you must have got fantastic skills from that, because you're dealing with people who are angry and upset and possibly shouting at you. And if you've been in those types of situations, then you have conflict management, you have self-management, because you know how to, you know, manage yourself professionally. You know, decision-making skills, time management, delegation. These are all really important skills in nursing. So it's quite good to move the narrative away just from all the caring and compassion to some of the more professional, complex skills that we see. So this, Natalie's just showing you that, which is how to download the booklet, and also that we have quite a lot of information on our YouTube channel as well, which we would direct students towards, which, you know, obviously highlights what we can offer as a university, but talks a lot about preparation. Unfortunately, I think that's me rattling on about preparation, so you might get a bit sick of hearing me, but there's lots of stuff out there to help them prepare.
Yeah, and we as a team do quite a lot of workshops with students,
yeah,
where we visit and bring the booklets with us and put them and, you know, get them to practice with each other and work in groups.
Yeah, and it's a confidence thing as well. I think people, I mean, we're all very bad about talking about ourselves in a positive way, but sometimes thinking about some of the skills that we do have and how we would represent those in an interview, or perhaps give examples of them in an interview about, you know, being part of a team or about dealing with conflict, all those types of things. It's not always about, I think people tend to focus very much on, oh, I don't have any healthcare experience, but actually forget about the experience that they do have. And what, you know, being reflective about how that's helped them develop skills, might help develop their confidence, even, you know, doing group projects at school or college, the skills they've learned. One of the things that we had a long debate about many years ago was about doing group discussions. You know, I know quite a lot of interview processes include these things where you're sort of roundtable group discussions. And my dislike of that is from the fact that it's somehow seen as not good if you don't contribute. But actually, if you're just sitting back and listening and, you know, going through things in your head, it doesn't mean you're not contributing. It just means that, you know, you're not talking over everybody else. But somehow that's seen as not positive, that you're not talking or you're not joining in. But actually, though, you know, the quiet listeners often are the ones who then appear at some stage with a decision or a point of view. So, you know, knowing about how you communicate or how you deal with group situations, that's really useful as an insight. So this is some of the criteria, obviously not all of it. And one of the first ones is the knowledge and awareness of midwifery or the chosen field of nursing. And that often is sometimes where they struggle. And I think sometimes it's about people thinking that they understand what they've chosen to do, but actually haven't explored it any further. So some of the resources such as NHS careers, the NHS careers website's very useful because people talk about how they've developed their career. Obviously lots of stuff on YouTube about what it means to actually be a student or to be a nurse or midwife. So that you have that real understanding about what you're actually going to be getting involved with, because as with anything, you know, we're very reluctant to take people on if they can't show that they've understood what it is they're going to be doing. And again, a lot of this will come from their reflection, but the awareness of the challenges during the course and how they're going to manage it. So that's not just about the academic work, it's about, you know, how they're going to get to placement, how they're going to manage being tired, stressed, all those types of things. That just shows that they've thought about it. And again, you know, obviously some students will have particular issues around their learning, and that's fine. You know, we're well set up for that, but it's good that they demonstrate an awareness of that. And I think contemporary issues in the NHS, I mean, you know, we're falling over contemporary issues in the NHS, but lots of people I interviewed last year didn't really think about what it meant to be nursing in a pandemic, what it meant for children, particularly children who've been growing up through all this and the implications for them. We know there's going to be long COVID, there's the issues around isolation and depression. And so it's about having that recognition of what's happening in the world outside and how that will impact on the patients that they're caring for. So, you know, a few years ago, it was very much about obesity and obesity in children or obesity in adults and the implications for the health and for the nursing. And we know now that that's a big risk factor in COVID. So, you know, all kind of ties in, but it just keeping them up to date with what's going on out there, because so it's the, you know, the social aspects, the political aspects of nursing as well that are really important. Along with that is these two kind of tie together, the non-judgmental approach and cultural awareness, and also working with others. And again, that, you know, comes back to things like team working, and whether that's through their school or college or work. And we've talked a bit about, you know, evidence of empathy and caring, and lots of people can give us examples of that. But I would suggest, you know, the two most important would be around the knowledge and awareness of the programme and the challenges of the course and the coping strategies. All the universities have got their modules on their website, so they can have a look at the modules and see what, you know, does that mean anything to them? Is there anything they're particularly interested in, anything they're particularly concerned about? Because they can say to us at an interview, oh, I've seen on your website you have a module on this. Could you tell me a bit about it and what it means? Because that helps them prepare, that we understand. And one of the other things that we'll bring up at the end is, of course, attendance at things like open days. Now that we're starting to welcome students back onto campus for open days, you know, if you're a student and you've come to an open day, then maybe there's something you've seen that you found interesting or that you'd like to talk about. Again, these can all be discussed at interview. Thank you, Natalie. So yeah, why do you want to be a nurse? I mean, it seems like a very strange question. Like, why do you want to be a nurse? Why do you want to be a midwife? And I think, you know, if they can nail that, if they nail that in their head about why it is they really want to do it, that's a really important question. And, you know, lots of people talk about being caring and compassionate, and that's lovely, but that's, you know, there's all sorts of things you can do if you're caring and compassionate. Teachers are caring and compassionate, social workers are, you know, people who work in nurseries. But why do you want to be a nurse? What is it about being a nurse or a midwife that appeals to you, that you've decided you want to do it? Obviously, we recommend journals or online materials to help them with their preparation and being aware of the issues around there. And that comes into political landscape as well, about policies and political changes that might affect the NHS. So just having that sort of awareness of what's going on in the world will help them. I think just give them a bit more confidence about what they're talking about at an interview. And I'm assuming that, you know, the other universities will have the same types of approaches to this. So it's not we're just asking them to prepare for us, it's about preparing for the whole process with the places they've applied to. So this is what we're looking at. We're looking at why would you make a good nurse or midwife? And, you know, that comes from the fact that, you know, you've turned up on time, you're properly dressed, you're in an appropriate environment. Communication skills, again, really important. Listening, talking, these are all the things that we're looking at. Obviously, they will give us examples of being compassionate and caring. Motivation, well, we're hoping that the motivation is coming from the fact they've actually applied to us and turned up for an interview. Diversity and equality, as I'm sure you're aware, is really important at the moment. We will explore their using their initiative, the team working, learning, problem solving, all these types of things. And examples of, you know, complex decision making, confidence, leadership, timekeeping. These are all things that we're looking for in our candidates, our applicants, and we will explore with them at interview. And if they can give us examples of these types of things, obviously that's really helpful. Okay. So it may help to focus on their transferable skills and get them to consider them. So we've talked obviously a little bit about this already, but delegation skills, leadership skills, prioritization, these will all be transferable into them as student nurses and midwives. Listening, communication, really important. Being analytical, really useful. You know, can you weigh up both sides of an argument? Can you see both sides of an argument? Because that's how, you know, nursing decisions are made. You know, there's not always a very clear yes or no decision. It's on what's the best possible outcome. And then where do you get your evidence from? Where's your research? Where's your evidence for the decision that you're making? So it might be worth focusing on, I'm sure you do, but focusing on some of these with your students prior to their interviews to get them to think about this. Because lots of people can talk about being caring and compassionate and give us examples of that, but not always about these other type of management transferable skills. So I don't have anything else to tell you, except our next open day is on the 13th of November. And that's on campus, isn't it?
Yeah.
Yeah, so they can actually come onto campus and see our facilities. They can have a talk, they can practice some skills with us. I think they were taking blood last time, or cannulating, yeah, on our dummies. Mm-hmm.
But you as teachers and advisors, we've got a newsletter that keeps you up to date with everything that Middlesex are able to support you with. If you want to sign up, you can sign up. There's the web link, and then you'll be getting useful information from us about all of the type of activity that will either be for your students or for yourselves, because we do quite a lot of CPD stuff for teachers and advisors as well.
So thank you. I mean, it's been a quick flick through. I hope it's been useful to show it from the other side. But is there anything that you'd like to know? Any questions you have? Any comments?
It'd be good, because I think they can unmute and talk, Caroline.
Yeah, do, yeah.
We will, what we will do is this should be being recorded, but what will happen is we will edit it out, all of the questions asked at the end anyway.
No, the open day this year, there's a question about open day being virtual. No, it is actually on campus. Students
Yeah,
can come on
we've got an
campus.
open, oh, I can't see the chat, sorry. Yeah, the open day on Saturday is on campus. They can book online now to attend, but we do have a virtual one on the 11th of December as well. But I would encourage anybody to come to the campus on Saturday, where if they've got their personal statement, they can bring that along with them, and they will be able to get some expert advice from the education liaison team. They'll be able to read their personal statement and give them some advice, but they can also attend, as Caroline just said, we will have all of our labs there open, and there'll be demonstrations happening where they'll be able to take part, maybe ask questions, and just generally come and see Middlesex, really, because this is only the second open day for the year.
And also, we'll have our students there as well, so they can talk to the students about student life or ask them any questions they might have. Because I think sometimes they prefer talking to students than they do talking to academic staff.
Yeah, I'm gonna stop recording it now so that we can answer all the questions. Is that okay, Caroline?
Yeah, yeah.